Some respiratory diseases, like lung cancer or heart failure, can lead to weight loss or weight gain. Weight changes over time can be a sign of disease developing or getting worse. If your client has one of these conditions, their care plan may indicate that they need to be weighed each day. Didn't we do this yesterday? Yep, every morning. So what could possibly change in one day? Well, if you lose 2 or 3 pounds in 24 hours or 5 pounds in a week, I need to let my supervisor know. So this way we watch and track it every morning, see what happens. So, how did I do? Good, no changes. You ready for breakfast? Yeah. All right, let's get your slippers back on. A client with a new or worsening respiratory disease may have a change in body temperature. Infectious respiratory diseases like pneumonia or TB can cause a fever. Clients with chronic respiratory disease are at increased risk of infection, and a new fever could be a sign of a new infection. Clients 65 or older may not have any fever, or their temperature may be lower than normal. You should be familiar with your client's baseline and know when to call your supervisor. Any clients that have an acute or chronic respiratory disease should be monitored for signs and symptoms of new or worsening difficulty breathing. A healthy adult takes 12 to 20 breaths per minute. Clients with respiratory disease may not move air well through their lungs and airways. That can result in tachypnea, which means breathing more quickly than normal. You might notice your client's nostrils flaring or see them using muscles in their ribs or collarbone to breathe. Or they might be sitting in a tripod position, leaning forward with their hands on their knees. If your client's been prescribed medication to manage their symptoms, be sure they're following the doctor's instructions. Make sure to call your supervisor if your client is having more trouble breathing than is usual for them, particularly if it includes increased anxiety, sweating, and confusion. Clients with acute or chronic respiratory disease can have increased production of sputum. Monitor them every day and report to a supervisor if you see new or increased sputum production. If your client's been prescribed medication to manage symptoms, make sure they're following the doctor's instructions. There are ways to make sputum and secretions thinner and more manageable, like encouraging clients to drink more fluids, especially warm liquids, if that aligns with the care plan. Your client may need to monitor the amount of oxygen in their blood. For a person without a respiratory disease, a normal oxygen level would be between 95 and 100%. However, your client may have a baseline that is not in the normal range. You need to know what's normal for your client. You should be familiar with your client's care plan, the client's acceptable blood oxygen levels, and when you need to call your supervisor. An oximeter is a small device used to measure the level of oxygen in the blood. It has a probe that clips to the client's finger or ear and a screen that displays the oxygen level. A normal oxygen saturation is between 95 and 100%. Lower than normal oxygen saturation can indicate new or worsening respiratory disease. That's why it's important to monitor your client's oxygen saturation according to their care plan and recognize if the level drops below the recommendations. Observe your client every day and document any change from normal patterns. If they're not getting enough oxygen, you might see signs of cyanosis, which is a blue or purple coloring of the lips. Or you might notice it's taking them more energy or work to breathe, or they're breathing faster than usual. Also watch for things like increased secretions, a new or worsened cough, or a low or high temperature. Report any changes to a supervisor. Call 911 if they're experiencing rapid and shallow breathing or severe wheezing, if they become anxious and sweaty, or if you notice pale or blue color around the mouth and lips. These symptoms indicate an emergency and you should call 911 immediately. All right, let's check your blood oxygen. Let me see. 89%. Is that good? 89%, is that good? Well, it's not unusual for someone with COPD to be a little lower than the average person, but for you, this is well below your normal range, and you've been running a little low for a couple of days now. So, what does that mean? Do I have to go see the doctor? No, you know what? I'll just make a note of it here, and we'll see how you're doing tomorrow. Okay, let's see. 89%. Is that good? Well, it's a little low for the average person, but it's not unusual for someone with COPD. Let's see. Hmm. Yep, you were fine yesterday, but you're running a little below your usual range today. So, what does that mean? Do I have to go see the doctor? Um, no. You know what? According to your care plan, it says that you should have some oxygen. So, I'm going to need to give my supervisor a call. So, just sit tight. I'll give her a call, and then I'll get that set up for you. Be sure to refer to the care plan for instructions for what to do for any measurement that's outside your client's normal range. If your client is consistently having abnormal readings, make a note and contact your supervisor. But even if the oximeter measures within normal range, if your client is having any signs or symptoms like rapid shallow breathing, sweating, wheezing, or they're pale or blue around the lips or nose, these symptoms indicate an emergency and you should call 911 immediately.